Janice. She's a patient of Dr. Barrett's. Janice, thank you so much for coming today. I really appreciate you sharing with us.
You're welcome.
It's very nice.
I had osteoarthritis, and the cartilage, first time I saw Dr. Barrett, the cartilage was very close to being gone. The most significant thing was how it was stealing my energy. It was very stiff. There was pain, which increased over time. And I lost a lot of muscle tone in my thigh. It affects everything in your life. It is very important that you go into this surgery when you can still move and you have strength, because it really helps the healing process. My life was on hold, and I wasn't doing anything that was fun, and the most fun I have is dancing, and I just couldn't do it anymore. So the decision making was all about, when I am looking at the quality of my life and I don't really have any, then it's time to just take the leap. But after I started investigating, I decided that I was going to go see Dr. Barrett. And I had done a lot of research before I had my other hip replaced, so I already went in there knowing a lot about how it goes and how important it is to get the right doc. And of course, things have changed in a very positive sense about how sophisticated the process is. And Dr. Barrett does the anterior approach, and my other replacement was posterior, and I think everyone was doing that then. And actually, most of the doctors are still doing that. But Dr. Barrett now is and has been doing this procedure for a number of years, like 7 or 8 years. And I was very interested in that because as I was learning, the rehab part of it was phenomenal. For me, there was less complications, and so since I have something to compare it to, essentially this is very, very little pain. I left 2 days after the surgery. Dr. Barrett came in the morning after my surgery and the following morning, which I very, very much appreciated. I was walking the same day that I had the surgery. I walked down the hall with a walker, but I walked down the hall and back.
Wow.
And I went home after 2 days, and the following day I could walk around the block, like 4 blocks. And so 5 days after my surgery, I really didn't need a cane or any assistance. Well, it was all I could do was to wait the whole 2 months before I saw Dr. Barrett so that I could say, now can I sign up for dancing? I don't think about the fact that I just had surgery. After 2 months, actually less, I don't even think about it. And there is nothing that reminds me except the scar, which is basically nothing.
Wow.
It's about that long. Yeah. I have absolutely no pain. My life is not only back to where it was, but I have all this energy. The first day that I came back this was 2 weeks later when I came back to the hospital for my physical therapy. So when I went back to my class, they all just came around and told me we couldn't believe what you could do and what you looked like right after your surgery. So I would say that anyone who has followed it, or someone that looked at me and saw what I could do, they would be sold. I would definitely tell them to see Dr. Barrett. It was a magical experience. I'm so thankful that I found Dr. Barrett. And he is, talk about an extremely focused person. and he listens.
That's key.
It is key. I knew so much about him before I went to see him, of course, but when I saw him, I was convinced, without a doubt, that he was going to be the person that was going to do my surgery, and I felt completely safe.
And I love your story. It's a wonderful story.
It is a wonderful story. Lucky me.